First Aid in Mental Health, Part 4. Fourth, encourage to get professional help. We all think you should go to the college counselor. No, I can handle my own problems. If other finds out, they will think I am mad and call me a loser. We will all come with you to the counselor. It is possible that some of our classmates will make fun of you. What if you do not focus on that and instead think about how you will feel better. In your last year's textbook, you already have studied the work done by counselors and clinical psychologists. Just as we go to a doctor when we fall sick, likewise, we should not hesitate to go to a mental health professional when we are dealing with a mental health issues. Mental health practitioners are trained, thus, they can help an individual identify their problems. They also help the individual cope with the situation. Fifth, encourage self help and other support strategies. You can also talk to your parents and elder brother. We will meet every evening in the park and go for a run. The days when we don't feel like exercising, we can just sit and chat. In addition to professional help, making the individual aware of other ways to deal with a difficult situation is important. Having social support, which is the support of loved ones, can be healing. Self help strategies refer to tasks that you can perform yourself. These are the tasks that help maintain your mental health. This will help increase your resources to deal with stress. Refer to box number 3 for some suggestions of strategies that you can incorporate in your daily life. Box number 3. Self help strategies are not luxuries but rather essential things that can be incorporated in your life. First, sleep hygiene. Ensuring that you get 7 to 8 hours of sleep every night. You should try to maintain the same schedule, that is, go to sleep every night at the same time and wake up at the same time every day. This will help set a routine and improve your well-being. Second, reduce screen time and digital involvement. You should disconnect every day for some time from your gadgets. Try to set a time limit for the number of hours you will surf the internet each day. Third, physical activity. Try to add some physical activity in your day-to-day schedule. This can be playing a sport or just going for a walk every day. Fourth, engage in activity that you enjoy doing. Cultivate hobbies. This can be any activity like reading a book or listening to your favorite song. Fifth, build and maintain social support. Meeting and spending time with your friends and family, participating in social gatherings. First aid in mental illness. In this section, we will see how the action plan that we just studied can be applied to psychological illnesses. We will be looking at 2 illnesses, depression and anxiety. First aid in depression. Risk factors of depression. Break up of a relationship, unresolved grief from childhood, experiencing emotional problems, family history of depression, exam pressure, problems with friends, and bullying. We all feel sad or unhappy from time to time, but in most cases, when our situation changes, we no longer feel this way. However, if we continue to experience these emotions for a long period of time, then it might require attention. If unattended, this can lead to the development of a disorder such as depression. Individuals who experience depression commonly have negative thinking style, with the themes of hopelessness and helplessness. They may say things to themselves like, I am a failure, I am worthless, I am unlovable, things will always be bad, nothing will ever change, and no one can ever help me. Some of the changes seen in the behavior of individuals suffering from depression is complain of feeling tired all the time and sleep more than usual. Second, not doing household chores or forgetting to do in spite of telling them. Third, withdrawing from the family and spending much time alone. Fourth, getting aggressive, especially seen in boys. Fifth, continuously remain sad. Sixth, perform poorly in exams. Seventh, bunk the classes or remain absent. Eighth, have difficulty in understanding what is taught in the class. Ninth, avoid friends and spend time alone. 10th, engage in risky behaviors like alcohol and drug use. Activity true. Try this. There are certain times when you feel tense or anxious. One strategy that we can use to help us calm down is the 5-4-3-2-1 technique. This is a simple technique that you can use whenever you are feeling overwhelmed by the situation and need to relax. First, take a few deep breaths and then follow the below instructions. Think of 5 things that you can see around you. For example, a pen, a book, etc. Think of 4 things that you can touch around you. For example, your hair, the ground under your feet, etc. Think of 3 things that you can hear around you. For example, the sound of traffic, sound of people who are talking around you, etc. Think of 2 things that you can smell around you. For example, the scent of soap from your hands, the fragrance of your deodorant, etc. Think of 1 thing that you can taste. For example, the taste of the last meal that you had, etc. Performing this exercise will help you focus on the present and stop worrying.